What's the difference between fastbraces Classic and fastbraces Turbo? Fastbraces Technologies offers two series of product lines: the fastbraces Classic series and the fastbraces Turbo series. The fastbraces Classic series comes in upper and lower metal, upper clear and lower metal combo, and upper and lower clear brackets. The fastbraces Turbo series comes in upper and lower metal and upper clear and lower metal combo. Patient visits with the fastbraces Classic series are every 21 days. Patient visits with the fastbraces Turbo series are every 12 days. The elbows of the fastbraces Technologies Turbo bracket are wider than the fastbraces Classic elbow design. This allows the elbow to touch the wire sooner, and thus the roots begin to upright sooner. In air travel, the bigger the plane and wider the wings, the smoother and more comfortable the flight. When one compares the side wings or elbows of a fastbraces bracket with the wings of an airplane, one can understand the difference between the fastbraces Classic brackets and the fastbraces Turbo brackets. The Airbus A380, in comparison to a Boeing 737, has wider wings. The greater the control achieved from a wider body results in a smoother flight. The fastbraces Turbo brackets are similar to the A380 in that they have wider elbows than the fastbraces Classic brackets, which one could say is similar to a 737. The angle formed between the vertical member of a fastbraces bracket and the line connecting the elbow to the vertical member is called the angle of movement of the wire. The angle of movement of the wire in the fastbraces Classic brackets is small because the side wings or elbows are not very wide. The angle of movement of the wire in the fastbraces Turbo brackets is larger because the side wings or elbows are wider. The larger the angle, the wider the wings of the airplane, or the elbows of the brackets, the smoother the movement. Therefore, the wider elbows of the fastbraces Turbo brackets will touch the wire earlier, upright the roots sooner, and provide for a smoother, more controlled motion, compared to the original fastbraces Classic brackets. When the wire moves in a bracket, it will contact the elbow and move the root. The more contacts, the more pressure the patient feels, the more the potential for pain. Thus, a wire elbow contact that is infrequent but has a long-lasting effect on the root movement is preferable to a more frequent one. This is similar to the flapping of the wings of a pigeon versus an eagle. The flight of the eagle is smoother and less of a strain on the body of the bird. Another way to understand this is by relating brackets to birds with no wings, small wings, and wide wings. The old style braces are like a bird with no wings. The fastbraces Classic are like a bird with small wings. And the fastbraces Turbo are like a bird with wide wings. The shorter side wings or elbows of the fastbraces Classic brackets are similar to a bird that flaps its small wings multiple times in order to fly. The wider side wings or elbows of the fastbraces Turbo brackets are similar to a bird that flaps its large wings gently, softly, and less often for a smooth gliding flight. The fastbraces Turbo wider elbows allow for infrequent wire elbow contacts, with a longer lasting effect than the fastbraces Classic brackets. Treatment time for non-surgical comprehensive orthodontic therapy should take more than 120 days with the fastbraces Classic series, and could take less than 120 days with the fastbraces Turbo series, even more comfortably, depending on the patient cooperation and the clinical experience of the treating doctor.
I have not yet had a patient complain about having pain with the Turbo. And the parents are amazed, the kids are amazed, they're really happy because all their friends, that's their biggest concern. They have traditional braces and they're told that they have been in a lot of pain, not just being sore, but being in a lot of pain. And pain has not been an issue with Turbo.
So fastbraces Turbo gives us a huge advantage in the orthodontic world because we can now treat patients in under 120 days. It's pretty phenomenal, and our patients absolutely love it.
When I say a quotation in days, patients' faces light up because as we all know, anything in days is better than weeks, months, or years, and who knows, the future might say hours.